According to Active Minds, a premier, not-for-profit organization that works for improving mental health and awareness among college students, 39% of college students experience at least one significant mental health issue. Based on findings from multiple studies, Reuters reported that between 2007 and 2018, the incidences of depression, suicidal thinking, and self-injury among U.S. college students has doubled. The United States Department of Education reported in 2014 that 1 in 3 undergraduates identified as having some type of mental health condition. In 2017, the National Council on Disability completed a report about mental health on college campuses, in which they acknowledged that we have reached a national campus mental health crisis. The Healthy Minds Study and American Psychiatric Association agree that only between 30 to 40% of students who meet the criteria for mood disorders actually receive mental health services, leaving more than 60% to fend for themselves. In 2014, it was determined that 86% of the students who died from suicide did not seek help at their school's counseling center. Since the 1950s, the suicide rate among 15 to 24-year-olds has tripled. It's estimated that every year, 6% of undergraduates and 4% of graduate students seriously consider suicide. Not surprisingly, the students considered most at risk are community college and international students, veterans, and students who identify as LGBTQ. In other words, the most minoritized and marginalized groups. The only real legislation that protects students is the Americans with Disabilities Act of 1990. But sadly, students must have a diagnosis and self-report in order to be afforded the protections and accommodations this act provides. Undoubtedly, mental health problems have a detrimental effect on students' academic performance, retention, and graduation rates if they do not receive the support they need. That's just the first step, getting the students the help they need. And colleges across the country have stepped up their efforts in this regard. Appalachian has an array of services and options for students struggling with their mental health, but that's only the tip of the iceberg. Once the students are getting the help that they need, there are grave concerns about being stigmatized. And on top of that, although it's been acknowledged that it is imperative that faculty attend to the whole student, in other words, consider the mental health of their students and adapt their classrooms in that accord, it's going to require extensive training and system-wide consensus and cooperation. In light of current world events such as COVID-19 pandemic, extreme national polarization, and weather and climate-related catastrophes, there can be no doubt that the rates of students with mental health challenges is only set to rise, and the opportunities for academic research are as limitless as the room for improvement. Thank you.